welcome to Listening to Lancaster. I'm Diana Martin with Hourglass, and it's my pleasure to be joined today by Madeline Reynolds, the director of Lancaster Early Education Center. Thanks for being here today, Madeline.
Thank you so much for having me.
I'd also like to thank Michael's Motor Cars, who sponsors these episodes, for their support of Hourglass. Madeline, let's jump right in. What's the Early Education Center and how does it serve the community?
Yeah, so Lancaster Early Education Center has actually been in continuous operation since 1915. We are a nonprofit early care and education facility, and our mission since our inception in 1915 has been to provide high quality early care and education to low income and working families. We are currently a Star 4 and NAEYC accredited childcare facility, and we also are duly licensed by Department of Education for our pre-K counts programs.
And how many children are you serving at the Education Center?
We have a license capacity and are able to serve up to 227 children. At this time, we have about 100 children enrolled.
Okay. So we've been hearing all about the childcare crisis recently. It's been dominating the headlines and it's impacting families across the state and around the country. Can you kind of explain what's going on and what you're seeing at the Early Education Center?
Sure. For those of us who have worked in the industry for a while, we've always known that staffing has been a big challenge for us. And it's kind of one of those things where I think it's starting to take national headlines because it's really gone from bad to worse. Since the pandemic, I think there's a lot of speculation as to why that is, but really what we're seeing now is people are needing safe learning environments for their children, and they're not able to go to work and they're not able to secure them. And we've been saying for a long time that in early care and education that this is the key component to the work we do. Number one to quality is the quality of your teachers. And if you can't find teachers, you can't provide that quality care and education. So I think as people are telling their employers are not able to go back to work, employers are taking that into consideration now and really, really seeing that it's really coming to light.
And what kind of staffing does it take to operate a facility like yours? What type of staff to child ratio do you need to maintain?
So in Pennsylvania, which is some of the lower ratios in the country, there are higher. It's dependent upon each state. So infants, you need one teacher for every 4 infants. That's a child under 12 months. 12 to 24 months, you're looking for one teacher for every 5 children. 24 to 36 months, you're looking for one teacher for every 6. And then your 3 to 5 age children, you're looking for one teacher for every 10. And you also have to have individuals, employed in your facility that can float, can cover breaks, because those ratios have to be met at all times. They're a little different when children are sleeping, but you always have to have somebody who's able to jump in if a teacher needs a break, use the restroom, etc.
I saw a recent survey of daycares in Pennsylvania that said 92% were short-staffed and that there's more than 25,000 children in the state who are on wait lists to get daycare or childcare. Are we seeing those type of numbers in Lancaster County? How are your staffing levels and how long do families have to wait on maybe a wait list to find childcare?
Yeah, we're definitely seeing that in Lancaster County. I've, talk and network with other directors and know lots of other providers and things like that. Centers are working on reduced hours, so they're offering childcare less hours per day than they typically would. My center is not, but the majority of us, including my facility, we're offering less spaces than we had available. Pre-pandemic, we had 2 one-year-old and 2 two-year-old classrooms, and now we have one of each. And it's because we're not able, not because we don't have the space, not because we don't have materials, not because we don't have the kids to fill it, it's because we don't have the qualified staff. And I'm definitely hearing that from a lot of my other colleagues as well.
Do you have families that are on a wait list right now to receive your services?
We do, yes.
Do you have any idea how many families or how long they might be on a waiting list?
It's really difficult at this time because we have to keep them on the wait list until we're able to hire the teachers. And, for our facility, like I think most other high quality facilities, it's not just a matter of hiring the teacher and opening the classroom right away. There's an onboarding process. We don't allow our staff to be left alone with children for a period of time. So all of those things would need to take place prior to opening the classroom. So, I mean, it's easily 3 to 6 months before we would be able to serve additional 1 and 2 year old children in our facility.
And what do you hear from the families on the wait list? Are a lot of them, are they saying that they're not able to go back to work until they get this childcare arranged? Or, kind of what are you hearing on the ground from families who are stuck in that position?
Yeah, absolutely. We have families calling every day asking, do we have a wait list? I think they're probably making similar calls at this point, and it's really difficult. It puts families in a challenging situation where perhaps they're not able to be as particular about the type of learning facility or the type of programming they're looking for their child because they're stuck between a rock and a hard place needing to go back to work. So we're definitely hearing that from families and asking us, do you have any idea? Or telling us, hey, I need to leave this center because the hours got reduced there. What are your guys' hours? We're hearing a lot more of that. It used to be a matter of families calling and saying that they were on a waiting list for subsidized state funding. And now they have the funding, but they can't find the space for their child.
Can you talk about some of the programs that you have at the Early Education Center and your approach to early education and what you're working on with the kids that you have in your care?
Yeah, absolutely. So we are a Star 4 NAEYC accredited childcare facility. Pennsylvania's quality rating system for childcare is called Keystone Stars, Star 1 being the base, and then Star 4 being the highest level of quality. And we also have obtained a voluntary national accreditation through NAEYC, which is the National Association for the Education of Young Children. So we follow NAEYC quality standards in our program, infants all the way through pre-K. We use the creative curriculum, which is a curriculum that allows for open-ended child-focused experiences. And we have pre-K counts as well, which is a state-funded pre-K program that's free to eligible families. Our philosophy here is really a very child-centered approach. We ground ourselves in the understanding of child development and what children need to learn. And then we really base our learning experiences in our program off of their interests and their needs.
And I know health and nutrition is also something that you're really concerned about with the kids that come in your door. Can you talk a little bit about that?
Absolutely. We're part of the CACFP food program, and we have a full commercial kitchen. We have a chef on site with an assistant, and we make our breakfast, lunch, and snack for our kiddos every day. It's really important to us to use as much local produce and fresh foods as we can. We try to keep everything really healthy, but kid-friendly as well.
So you're focused really on affordable childcare. Can you talk about what does affordable childcare mean and why is that so critical for a community like Lancaster?
Yeah, absolutely. So affordable childcare is not a reality for a lot of people. And unfortunately, families are spending significant amounts of their salaries on childcare because it is providing high quality childcare is very expensive. And it's always been our mission here to make sure that socioeconomic status doesn't dictate whether or not a child has a high quality early learning experience. We believe that that's, a right to children and families. And then that's really critical to keeping a stable workforce as well as helping children get the start that they need.
And how accessible do you feel that affordable childcare is in Lancaster County?
I would say it's pretty low on the accessibility scale, especially for, there are state subsidy programs available. However, that is for a low income family. I think like those middle income, it's really, really challenging because you're not bringing home the type of money that you need to put your child in a full-time childcare program in many cases.
I've seen a statistic for affordable housing that housing is considered affordable if it is 30% or less of your income. Are there similar metrics for that for childcare to kind of make a determination if it is affordable for a family?
Yeah, I believe the most recent that I've seen where it said childcare would be considered affordable if it was 7%
Okay.
of a parent's income.
Okay. Yeah, that's helpful. And can you talk about the pandemic and COVID-19? What kind of impact has that had on the early education center, but also on the young children and kids that you're seeing coming in your doors every day?
Yeah, I think the main thing for the pandemic, one thing that I've seen a lot in the headlines that's really talking about, I think our society is focused on, and I'm actually less concerned about, is the social impacts that it had on young children. And there's been a lot in the news lately about it being difficult for children because they were pulled from schools or they were pulled from early care programs, and the social aspect being so key for them. I really think the biggest impact on young children and what I feel like we're seeing here is the fact that young children are as stressed or not stressed or as well or not well as their caregivers. It's a huge thing for a young child to be in an environment with a parent or a caregiver who is under a lot of stress and a lot of pressure, which I think people in the best of situations found themselves in the pandemic. And especially when you have parents cut off from extended family and things like that, there's those high stress levels, which children do feel and, really manifest in those different ways of like behaviors or seemingly a lot of like dysregulation. So I think that that's something that was kind of less brought in the focus of people, but I think that we're really seeing here. And that's been a big focus as we come back, is really to just be doing a lot of observations on our kiddos, really focusing on those routines and that consistency and giving them that really safe, stable, secure place to be.
From your perspective, what is the solution to the childcare crisis that we are facing? Is there any hope for the future or programs or ways the community could support your work?
Yeah, I definitely think that there's hope for the future. And I think one of the big hopeful things is that people are talking about it and it's getting national attention. There's a lot of statistics and data that's being put out in front of people who make decisions. And I know like from our advocacy organizations and stuff, they're really taking full advantage of that and getting those facts out in front of the people who need to see them. So I think that's very motivating and very helpful. I also think in Pennsylvania, there's a lot of great work being done around like teacher preparation programs and educating those who are looking into education for college and things like that. That's a huge piece of it, making teachers aware that there's a whole another age group of children that need served and giving them the skills that they need to do that. So yeah, I definitely I think it'll take a lot of time. I think we're headed in the right direction now.
I saw recently that Pennsylvania is going to designate 655 million of its American Rescue Plan funds to the childcare industry in Pennsylvania to help recruit staff or retain staff, even to help with other, even mental health services for staff and children. Is that something that you'll be applying for a grant for any of those funds?
Yeah, absolutely. Yep. The state put out the application. It's a very simple application process meant to serve as many people as possible. And yeah, I think a lot of centers, including my own, will be applying for it and really putting that towards like the staff hiring and retention. Low wages have been a huge piece, I think, of the problem for a long time, as well as just the lack of feeling like this is a professional position to be a part of. And I think, really helping raise those wages and pay people what they need to make a good wage and what they deserve due to their education. I think that's a really good step in that direction.
Yeah, I hope that COVID has taught our society to think more about the caregivers and how important they are.
Absolutely.
And what about, are there ways that people watching this interview from like the Lancaster community can support the Lancaster Early Education Center?
Yeah, absolutely. We're a nonprofit. We do accept donations. We participate in Extraordinary Give. As holidays come up, we have lots of folks who like to adopt our families, adopt our classrooms, and give in that way. Volunteer, you can always volunteer. There is a process that volunteers have to go through, obtaining clearances and things like that. But coming in and spending time with our teachers, coming in and spending time with our kids, they absolutely love that. We do that a little less with COVID now, but with vaccinations and things, we're working on getting volunteers back in the door. And also anyone, you're going to school, you want a job, you want to think about us, we would be happy to hire. We're always looking for qualified candidates to work at our center if you have a passion for early childhood and young children.
And what's your favorite part of your job and working there?
Oh, the kids. Definitely working with the kids. Yeah, I love it. It's super fun, and there's a level of joy that comes with the work that is really meaningful to me.
Is there anything I didn't ask about that you want to add?
No, I think that was great. Very comprehensive. Thank you.
Well, I really appreciate you coming on to just give us a snapshot and kind of what this childcare crisis really looks like on the ground in Lancaster County, and appreciate your time today. For everyone who's watching, you can find more episodes of Listening to Lancaster on our YouTube channel or on our website at hourglasslancaster.org. And thank you so much, Madeline, for being with us today.
Thank you for having me.